In this video, you're going to learn the role of the pelvic floor for the birthing process. You're going to learn exactly how to prep your pelvic floor for the delivery of your dreams. Now, if you are shooting to have a vaginal delivery and you want to have decreased tearing, decreased push time, and decreased injury with baby and delivery, and you want to recover really fast, you need to listen to this video. This video, we're going to go through exactly the role of the pelvic floor, how to start preparing your pelvic floor for the birthing process, some non-negotiable things that you need to do every single day in order to prep for the delivery, and then we're going to talk all about how to breathe baby out of your body. In this video, you will learn exactly how to have your dream birth. So first, let me introduce you. This is the pelvic floor. The pelvic floor is a bowl of muscles that sits right between our sit bones, and it is the bottom of our cores. The baby comes through the vagina, which is embedded in the pelvic floor. The vagina has to open so that the baby can just come through the birth canal. It does this by helping by the baby's pressure of the head, but also by the birthing person opening the pelvic floor themselves and helping breathe in order to help maintain this opening. And the uterus is the muscle that then pushes the baby down and out through the birth canal. So how can we make sure that we ultimately are super prepped for the birth of our dreams to get this vaginal opening even more expansive and make sure that we don't have injuries and we don't need things like forceps and, we don't end up pushing for hours and having to use vacuums? This will be how to do that. And in order to start prepping your pelvic floor for birth, you absolutely need to start breathing. Your intentional breath work is going to help connect you down to the pelvic floor. So let's go through this together. Our diaphragms, which sit underneath our rib cage, when we use them and we inhale, the lungs fill with air and the diaphragm then goes down and pushes on the top of the uterus, helping open up the cervix. Well, it's not going to open the cervix if you're not in labor, so you don't have to worry about that. But when you are in labor, using this type of breath pattern is going to be absolutely epic to help bring baby down birth canal and also help open up the cervix and help open up the pelvic floor. So we're going to use this type of diaphragmatic breath to help bring baby down and also open up the pelvic floor. So you're going to take a nice deep breath into the belly. Inhaling and opening pelvic floor. Exhale, you let there be a natural recoil. From the side, what this looks like is if my hand's on my belly, my hand's on my chest, all the air is going into the hand on the belly. Inhale and open. Let that belly fill with air. Exhale and let it go. That is a diaphragmatic breath, and you want to be practicing this 5 minutes a day. When you do your diaphragmatic breath, you want your pelvic floor to open and elongate. If you cannot feel that, one of the things that you can do is when you're at home, in bed, or in the comfort of a safe space, you can just put a finger right inside your own vaginal canal and see if you feel the vaginal canal opening when you inhale, and then you might feel some recoil or closing or kegeling when you exhale. So when you inhale, you want there to be an opening, and then when you exhale, there's going to be a natural closing. And so you can just tactilely feel that and practice that in your own body when you're in a safe spot to do so. Once you get that connection going, then you want to utilize it. And that's where making sure you're doing 5 minutes of breathing every single day is going to be absolutely essential. Now, the reason I don't prescribe Kegels during pregnancy is because that's training the body to contract and utilize these muscles in a contracting space. And we want to focus on the eccentric strength of them and the elongating of these muscles so that when the time comes and baby's coming through the birth canal, these muscles are expansive and can stretch and expand, and all the strength comes from that ability to expand, and then baby can slide through the birth canal because the uterus is pushing the baby out. If we think we're going to volitionally push the baby out, that's so much stress down on our pelvic organs. And if you have a very tight, cemented pelvic floor, it makes it really challenging for the baby to get through the birth canal itself. And so if you can do this type of breathing, that's going to be the most advantageous for you prepping for your delivery process. Now, the next thing I want to talk about is having a bowel movement. If you get the urge to poop, when you get the urge to poop and you poop like this every single day, this is going to be a non-negotiable practice for prepping for birth. So when you are getting the urge to poop, you want to always listen to that urge. Go within 15 minutes, go sit on the toilet, fully relax your body. Don't flex your feet up. You want your feet flat on the ground. You want your knees at least fist width apart, maybe more, so that the belly has space. And as you're sitting to poop, you're going to do the diaphragmatic breathing. So a lot of times when we get the urge to poop, we just go sit on the toilet and we push the poop out. We want to repattern that. We want to start breathing the poop out, because if we can breathe the poop out, then we're going to help open up the pelvic floor. It's going to decrease the risk of anal fissures and hemorrhoids. And it's going to help take the pressure off the pelvic floor and allow the stool to leave our body with much more ease. So I highly recommend during your pregnancy, every poop you have from here on out, using that type of breath pattern of breathing the poop out is going to be absolutely essential in prepping to breathe the baby out of your body and allowing that pelvic floor to open and elongate with each breath pattern, with each inhale. So those are a couple things that you absolutely should start to do to control your pelvic floor and prep your pelvic floor for birth. Now, I want to teach you a little bit about the layers of the pelvic floor, because we're just talking about the pelvic floor in generalities, but there are 3 layers to the pelvic floor. There is this first layer, there's a second layer that's more fascial and sphincters around the urethra, then there's this third layer that's like this deep layer. And this is the layer that is often elevated and tight in people who are high stress and or have been athletic in their life or are heavy exercisers, or if they have increased joint mobility. So they're very, very flexible people. They tend to have all these categories of people tend to have very tightened pelvic floors. And so I highly recommend going through the body motion birth preparation protocol, which is where we balance the muscles internally and externally to ensure adequate blood flow and length of these muscles to really prep them for birth so that they can melt and open and elongate with a lot more ease than just having the uterus have to push against a cement wall. So I hope you found this helpful. People fly from across the globe to come to our clinic in Edmonds-Poulsbo, Washington, and prep for their dream deliveries. They come for about 4 to 5 days during their pregnancy to really get connected to their pelvic floor, change the length of their pelvic floor, and then they go home and practice for the rest of their pregnancy, and they have much better deliveries. I'm Dr. Allison Felt. Thank you so much for joining me, and I wish you the delivery of your dreams.